affordable, for one, and being able to afford to go to a doctor when you need to go to a doctor.
It's really, there's really no word that comes into my mind. What comes into my mind is how unjust and how expensive and how really terrible it is.
Breast cancer, ovarian cancer, sprained ankles, broken legs, lupus, and bipolar disorder, just to name a few problems my family has faced. In the Declaration of Independence, it says that all men have the inalienable right to life. If this is true, why can't everyone in this country afford health care? In this film, I set out to demand answers about the healthcare system in America. I began by looking at the Affordable Care Act.
I can't really describe, and I don't think anybody can really describe the Affordable Care Act. The Affordable Care Act is one of the most complicated and along the way changing law. The law has, I think, something like 1,700 pages or 1,900 pages, and I don't think that there is anybody who really knows everything that's in it.
I know that the Affordable Care Act is supposed to be available for everyone, and that it's based on income. So I think that's what makes it affordable. And if you have an income, it's based on income, and if you don't have an income, you're still able to get or afford some type of quote-unquote health care.
Before, when you wanted health insurance, if you didn't have it through your job or you didn't have access to it through Medicare or Medicaid, you would have to go to every different insurance company, and you'd have to ask them whether or not they wanted to sell you insurance. So you have to fill out a question about your whole medical history, everything that's happened to you in the past, and then each of those insurance companies would decide whether it wanted to sell it to you. And then you'd have to do research to see what is covered by those insurance plans, because there were some things they were required to cover, but it was different from state to state. There's a list of 10 categories of what's called essential health benefits that every plan has to cover. So all plans are much more comprehensive than they were before, and they can't reject you for being somebody who has a pre-existing condition or had a medical history where you've had a lot of different things happen to you in the past. So it's quite a bit different. And now there's also a website, Get Covered Illinois, where you can go to right away and find whether you're eligible for Medicaid or whether you're eligible for private coverage, and then see all the plans that you might be eligible for.
I've gone online to Get Covered Illinois, and wasn't able to make it through the first stage of it because of some of the questions that it asked, and so my next step is probably the phone, and if that doesn't work, then I will probably go down to one of the offices and get face-to-face with somebody.
Independent experts now estimate that millions of Americans who were uninsured have gained coverage this year.
One of the things that the Affordable Care Act does is it used to be that children, once they left school or college, were on their own. One of the provisions in Affordable Care Act is that children are covered by their parents' insurance until they turn 26.
35% of people who enrolled through the federal marketplace are under the age of 35.
Some benefits of the Affordable Care Act are no annual or lifetime limits on health care, and also a large improvement of the women's health services. This means no more being charged more because I'm a woman. Because I'm a woman, does this mean that I don't deserve the same as a man? I feel that health is important for everybody.
Just being a healthy nation, I think right now there's been a lot of talk and movements about, even our children getting to the place where they're moving and active and eating healthy, and, studies that show that America is becoming, overweight, and, obesity becoming a legal disease and things like that. So, and these are things that need medical attention, where sometimes individuals can't always, work through the process, but need professional medical input, advice, in order to address some of those situations.
We all, we need to be healthy to do the things that we really want to do in life, like have a good job where we can go into work every day, raise our kids, and spend time with our families, and just anything you want to do. If you're not healthy, you're not going to be able to get the most out of your life.
It is important because you have to take care of yourself. In order to be a productive social being, you need to be taken care of. If you have any kind of physical or mental issues, needs, you can't really exist. And besides, healthcare can be a question of life and death.
And it is a matter between life and death. All of the changes between the Affordable Care Act could have helped my grandmother get the help she needed early on, before it was too late.
That the number of Americans who've signed up for private insurance in the marketplaces has grown to 8 million people.
Will certainly be more costs in the immediate future, because the more people who get insurance, they'll certainly, we want them to go see doctors maybe when they couldn't before, and go in and get the care that they need. So there will be a little bit more costs. One of the theories, though, is that if you can get people to go to see a doctor on a regular basis, maybe we'll catch some of these diseases that they get before they get too bad. So I would say in the short term, you might see you'll definitely see more costs up front, but hopefully all of that pays off in the future when we have a healthier population.
Again, I think if there was any law that I could introduce, it would be to make it affordable, so that almost anyone could be able to afford and get health care if they need it.
I didn't grow up in this country, and the more I learned about the healthcare system in this country, the more appalled I was by the disparities and by the way, by how much it costs. Single payer, which we also call improved and extended Medicare for all, would guarantee health care to everyone from birth to death. So everyone would be covered for life. We envision that it would be paid for by taxes, and it would be publicly funded, that therefore it would be publicly funded and privately delivered.
I think the American people need to do what their role or what our responsibility is as citizens in regards to making sure we're providing all the correct information and doing whatever it is that we need to do in the process. And then the government, in overseeing the process, needs to be responsible and accountable for making sure that it is equitable, that there isn't any opportunities for classism to get attached to this.
Overall, the Affordable Care Act is a step into the right direction, but we shouldn't stop here. We need to fight for the healthcare system that works for everyone. In the making of this documentary, there are still worries in my mind and challenges to face. But with this new healthcare system, I believe that everyone can now claim their right to life, liberty, and the pursuit of happiness.